About 1 in 9 women in the United States will have a hysterectomy in their lifetime. Of those, 10 to 30% will develop vaginal vault prolapse. When this happens, the vaginal tissue basically collapses on itself. Dr. Kaushik Shah has treated thousands of these women, and he's here to talk about a new minimally invasive robotic procedure to treat this. Good morning.
Good morning, Melissa. How are you?
I'm good. So tell us what happens after a woman has a hysterectomy that makes her vulnerable to this.
Well, what happens after a hysterectomy and also as a woman ages is that a lot of the ligamentous support of the pelvis tends to stretch and descend, sort of like as you get wrinkles, you have descent of those ligaments.
Gravity.
Exactly, gravity gets the best of you. And what happens is the structures in the pelvis, like the bladder, the rectum, or the bowels, can descend from their normal position and descend and basically pooch into the vaginal area and then sometimes protrude out of the vaginal area.
Wow, so they constantly feel like they have some kind of pressure or...
Exactly, and it can manifest in different ways depending on which of the organs can descend down. If your bladder descends, sometimes it feels like it's difficult to empty your bladder. Sometimes you have urgency and frequency of urination. Sometimes when you defecate, you can have a further bulging of that mass.
Wow.
Sometimes it feels like you're actually sitting on a mass and you have an uncomfortable area between your legs.
Oh, that would be horrible. So this is a way to treat this. In the past, the treatment has been kind of invasive, takes a long time to heal, I would assume.
Yeah, correct. It's usually an open surgery. It's about an 8 to 10 inch incision that begins at the pubic bone up to the level of the belly button. And what we do is we typically resuspend those organs back to their normal positions using suture and mesh and material like that.
Okay. And so with this new robotic technique, tell me how that's better.
So, sure, the robotic technique is a way that instead of using my hands to operate, which requires a large incision to accommodate them, we basically shrink my hands down to something about the size of a dime. And those are the robotic hands. We usually operate about 10 feet away from the patient, insert those robotic arms inside the patient into about 4 incisions about the size of a dime, and we do the entire surgery that way. The same open surgery but through tiny incisions, and we resuspend the organs back to their normal anatomical position.
So is the recovery about the same?
It's much faster. You usually go home the next day after the surgery. The blood loss is minimum, and it allows you to, usually get back to your normal activities much faster. We had a patient of ours that won a golf tournament about a week or so after having the surgery. So
this is so timely because yesterday we were just talking about robotic surgery to perform hysterectomies, and this is becoming so common.
Yes, I think more and more we're finding robotic or laparoscopic techniques. They're finding their way into all types of surgery, and we're able to do the same surgeries in an equivalent manner and get the patients home in a faster, safer manner.
Is there anybody who's not a good candidate for this new robotic surgery?
The main candidate for any sort of laparoscopic, main person we want to avoid laparoscopic or robotic type surgeries are on usually in patients that have had prior multiple abdominal surgeries, because that usually causes a lot of scar, what we call adhesions, which can make that surgery a lot more technically difficult or unsafe.
And there are different degrees of prolapse as well.
Correct, yeah, there's levels 1, 2, 3, and higher, and what happens, that grades the amount of descent from its normal position to a position that in the highest grades where actually, again, it prolapses outside of the body.
Wow, all right. Well, it's nice to know that there's a new treatment for this that's a little less invasive.
Sure is.
Appreciate you being here.
Thank you very much.
Dr. Shah, and he is with Austin Diagnostic Clinic.